There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question: what is the best way to lower my blood pressure and heart rate? Answer by Sosifina Tanyafai. 1. Diet. Your diet will raise or lower your blood pressure. Eliminate caffeine. Consume fermented foods. If your gut flora is not healthy, your risk is much greater for heart disease, as well as many other chronic health problems. The best way to optimize your gut flora is by including some naturally fermented foods in your diet, such as sauerkraut and other fermented vegetables, yogurt, kefir, and nado. 2. Exercise. Use exercise as a drug. Physical activity is by far one of the most potent drugs there is, and its side effects are exactly the kinds you want to experience. Regardless of the primary reason you start an exercise program, your efforts will be rewarded in countless other ways. 3. Vitamins. Optimize your vitamin D levels. Blood pressure is typically higher in winter months than in summer. Sunlight actually affects blood pressure in several ways. Lack of sunlight reduces your vitamin D stores and increases parathyroid hormone production, which increases blood pressure. Exposure to appropriate amounts of sunlight is a basic health requirement that extends far beyond blood pressure normalization. 4. Stress-free. Controlling your stress is crucial. By teaching your body to slow down and relax when stress hits, essentially short-circuiting your physical stress reaction, you can protect your health. 5. Supplements and other alternatives. Calcium and magnesium. Daily calcium and magnesium supplementation can be useful in lowering blood pressure, especially if yours is on the high end of high. Vitamin C and E studies indicate that these vitamins can be helpful in lowering your blood pressure. Ideally, you'll want to get the right amount of both these nutrients through diet alone. If you decide you need a supplement, make sure to take a natural, not synthetic, form of vitamin E. You can tell what you're buying by carefully reading the label. Natural vitamin E is always listed as the D form, D-alpha-tocopherol, D-beta-tocopherol, etc. Synthetic vitamin E is listed as DL forms. Olive leaf extract. Supplementing with 1,000 milligrams of olive leaf extract daily for 8 weeks caused a significant dip in both blood pressure and LDL, bad cholesterol, in people with borderline hypertension. Breastfeeding. Studies have shown that babies who are breastfed for more than 12 months have a dramatically lower risk of developing hypertension. Answer by Nava Castillo. If your blood pressure is abnormally high, you should reduce as quickly as possible. There are ways to do it by doing nothing other than a diet and changing your lifestyle. But if you already have hypertension, your best chance remains to consult a doctor and seek treatment. Here's what you need to know about the options available to you. 11 ways to lower blood pressure naturally. Answer by David Wayne. Increase your physical activity to allow your heart to become more efficient at pumping. Reduce your sodium intake. Increased sodium in your system causes you to retain water, the extra fluid causing a higher pressure. Improve your diet. High cholesterol and high triglycerides can lead to arteriosclerosis/atherosclerosis, hardening of arteries and plaque buildup, causing the heart to work against higher pressures.